Hello, hello, my future dental assistants. I'm going to talk to you today about preparation for patient care. This is chapter 13. You can go to chapter 13 in your book and just pause this video until you get to it. All right, so the first thing we need to get, especially for a new patient, is a patient record. We need to get their personal information on the patient registration form, the medical history, dental history, and what problems they're having. A lot of dentists are doing this on the computer now. Some of them are giving paperwork ahead of time, and they can fill that out before they come to their appointment. Personal information includes the name and the address, of course, their social security number, insurance information, their doctor's name, and emergency contact. We always get the social, especially if they have insurance. At our office, we've been getting their license also, a copy of that. Medical information, that includes past surgeries they may have had, systemic diseases, allergies, and injuries. If they have any, say, hip replacements or anything like that that's metal in their body, lots of times we have to know if they need to be pre-medicated. And if that's the case, we'll have to call the doctor and see if pre-medication is needed. Patient concerns are on the form. Why are they there? The reason for the appointment. How do they feel about coming to the dentist? Because we need to know how to treat them. If they're very afraid, we need to treat them with a little more tenderness than, the normal person. And how did they experience their previous dental care? Another thing we kind of do is we give them a physical assessment as they're walking back. Their gait, which means how they're walking, their speech. If anybody has a behavioral problem, we need to know that. Like if they have ADD or ADHD, their eyes, we look to make sure to see if they're dilated, their symmetry of their face, droopy eyelids. That can tell us a lot about the patient. They also have to consign any consent forms in the clinical setting. If we're doing an extraction, they have to sign a consent, or endodontics, which is root canals, who referred them to us, and we'll need to take, see if they have any x-rays that we can use that they've taken recently. Clinical examination, we look at their mouth and their lips. We look for cracking or ulceration. We look at their smile line, their vermilion border, the commissures, external floor of the mouth, and the lymph nodes. You can look in your book for a little more information about that. We also check their TMJ, see if they have any problems with that. We look at for any lesions, for any abscessed teeth, any color changes. We look at the floor of the mouth and the tongue. And here is a little guide. There's the commissure of the lip, the smile line, the vermilion border. We look at the outside tissue, the mandible, which is the lower, and the floor of the mouth. So we examine it on the outside. Also, we need to look at the lymph nodes, if there's any swelling, abnormalities, tenderness, infection present. While we're examining the TMJ, you can see where the hands are placed. We check for noises, tenderness, any pain or limited function. And if they have all of those things, we might recommend a night guard for them to wear. The floor of the mouth, we look for tenderness, abnormalities, lesions, and bony tori. Tori is bone growth that can happen in the patient's mouth on the inside. You will see that in the future. We also look for, we examine the oral mucosa and the frenum. The frenum is a little bitty piece of skin up under the nose. As you can see in the picture, is that little line of skin. Is the narrow band of tissue that connects the two structures. We look at the tongue and the palate. We look at palatal tori, if they have any tori on the top. Geographical, we check the tongue, any lesions that may be present. And then we examine the tongue. We look at the color, see if there's any coatings on it, any abnormalities. All right. So as the dentist is looking at all of that stuff, we give the patient a diagnosis and a treatment plan. The dentist will evaluate all observations, reach a conclusion, and formulate a treatment plan. Some dentists will send this to their office manager. Some dentists will print up a treatment plan right then and there. It just depends on the dentist. All right, everybody, I hope you learned a little bit. We will be having some quizzes on this, so please pay attention to this PowerPoint. Have a good day, everybody. Bye.